Good morning, and welcome to the Association of Women Surgeons interview series for eConnections. My name is Faith Robertson, and I'm a third-year medical student at Harvard. Joining us today will be Dr. Patricia Numann, a woman of many firsts and an icon in surgical skill, leadership, and education. Dr. Numann's story is seated in New York, but her impact has been global. Numann was born and raised in New York and attended undergraduate and medical education there as well. She joined the faculty at SUNY Upstate Medical University in 1970 as an assistant professor of surgery and was the university's first female surgeon. Throughout Dr. Numann's surgical career, her clinical and scientific interests have focused on diseases affecting the breast, thyroid, and parathyroid, a commitment reflected in the establishment of the Patricia J. Numann Breast and Endocrine Surgery Center at Upstate in 2007. Numann has also served as an author or co-author of several chapters in surgical textbooks, as well as numerous peer-reviewed publications. Her trailblazing efforts and leadership roles are innumerable. If I were to try to list them all, we'd probably run out of time. But here are a few. She was the first woman to serve as the chair of the American Board of Surgery and was vice president of the American Association of Endocrine Surgeons. She was also the first woman to be the vice president of the American College of Surgeons and chair of the American Board of Surgery. Special to us in AWS, she founded the Association for Women Surgeons in 1981 and later served as its president. Additionally, she was one of the founding members and president of the Association for Surgical Education. She is also a professor emeritus at the State University of New York Upstate Medical University and continues to move the field of surgery forward through education, advocacy, and mentorship. Dr. Numann, thank you for joining us today. Now, Dr. Numann, you trained in a time where there were very few women going into medical school and even fewer pursuing a career in surgery. What was that like?
Well, I guess when I decided I wanted to be a doctor, I was perhaps very naive, but I just didn't understand that that was something that you couldn't do because of your own ability, that it was a gender-related issue, and that was reserved for men, not for women, and particularly white Caucasian men. So I was naive, and I didn't realize how naive until I got to college, and basically the women who were pre-med were told to make sure that they had Plan B because very few of us would ever get into medical school. And I did actually develop a Plan B, but I developed a Plan B because I really didn't like college that well and thought that if I just went to summer school one year, I could graduate a year early and teach science. And my advisor at college said, well, why don't you just take MCATs and apply to medical school early, which I didn't even know you could do. So that's what I did. And I got into medical school after 3 years of college. So it helped me, and that was actually fairly unusual. But I don't think that you think about what everybody else is doing. I think you just think about what you're doing and how it's going for you. So I did get into medical school, and I went to medical school. I must admit that I didn't like the first 2 years of medical school much more than I liked college. But by the time I got to my third year of medical school, I really loved that, and that was what I wanted to do. And then when I decided to be a surgeon, that I wanted to be a surgeon, again, everybody, says, well, you can't do that. We don't take women in surgical residency, ra-cha-cha. And, my belief was that's, because you're not very well informed and you really should take women and, well, take me and I'll show you that women can do a good job. So I actually had to make a deal to get my surgical residency with the chairman, who said that he would take me as a preliminary if I did medicine 6 months and surgery 6 months, and if I did well enough as a surgical intern and if I still didn't want to do medicine, he would consider giving me a second-year spot. In those days, it was a pyramidal system, so you could get knocked out at any level. But I did do well, and I did get a second-year spot. And then, each year you competed with the people in your year. But fortunately, a couple of the men decided that they had other plans, so that we ended up with 4 of us in our 4th year that went on to our 5th year, which is, was good. But there were many things, and it was just my view was that they just were not used to having women, and so you had to show them how to do it. They didn't have a place for you to sleep, so you had to kind of meet with the administrator and figure out where they were going to let you sleep, and they didn't have a place for you to dictate, so you had to sort of discuss that with them and figure it out. And it was more of having them kind of just have the realization that they had a woman now and they had to figure it out. One at the Catholic hospital, the head of the Catholic hospital actually arranged for me to sleep in her office at night because the only call room they had was a big room with a lot of bunk beds, and she didn't think I should have to sleep in that room with all the men. So she gave me a nice cot in her office. It had an attached bathroom, so it was great. I even had air conditioning, and the guys didn't. So, but they were for you.
Mm-hmm. Was there anything you remember being particularly challenging for you as a woman?
Not for you.
Well, I think that when I was a resident, there was a lot more sort of sexual abuse of sorts, whatever you want to call it, of, people saying things about you or to you that were really inappropriate and making, advances and on, that were a little bit difficult because you couldn't necessarily piss them off. In those days, you could be thrown out of your residency because they didn't like the color of your tie or shirt. So, you had to keep everybody happy. But you got kind of used to it after a little bit, and you figured it out. I mean, it's just the way it is in life. I mean, there are a lot of things that happen to you or people say or do to you that are really not pleasant, but you kind of deal with it.
Wow. Well, I'm sorry that you had to face this adversity during your training, and we thank you for being an inspiration for others who had to go through that same thing and also changing the system along the way so it doesn't like that as much anymore. And it sounds like the beginning of the Association of Women Surgeons started with a breakfast meeting. Can you tell us more about that?
Well, actually, the Association of Women Surgeons actually happened because I went to the first Women in Academia leadership program in Tucson, Arizona, and I think it was 1979 or something like that. And it was run by a lady named Marlise Whitty, who's a doctor on the faculty there. And it was sponsored by the AAMC and AMWA. And there were a limited number of spots, and I actually didn't get a spot, but I wanted to go. And so my dean paid my expenses for me to go. And at that meeting, I already realized that that it was unfair to women in academia, that you didn't get promoted as well, you got a lot of the crappy jobs, and on and on. So I wanted to go, and I was associate dean at our school at the time. So,
and this is at Syracuse?
Yeah. So it's Upstate Medical University. So I went, and I really got enraged because not only were surgeons treated poorly, but even pediatricians. How could you treat a woman pediatrician poorly? I mean, come on already. What can they be doing wrong? And it was true for really all specialties, and the problems were similar across the board. Lack of promotion, unequal pay, poor facilities, lack of resources, all of the things that make you able to survive academically and advance. There were no women in any leadership positions. There were no chairmen anywhere. There were no, with the exception of Women's Medical College. And even at Women's Medical College, they had some men chairing some of the departments. So it was just crazy. And that raised my level of consciousness. And we, as a group, promised that when we left that meeting, we would do something to improve the status of women both locally at our institution and nationally. And so in my own institution, I started a women's group. And nationally, I thought, well, what can I do? I don't even know any other women surgeons. So that's why I put up the sign at the American College of Surgeons for women to join me for breakfast. Mm-hmm. And those repeated breakfast meetings drew more and more people, and then there was a decision that it should be a formal organization.
That's so wonderful. Now, can you talk about your current involvement with AWS? I know it's growing nationally and internationally as well.
I guess in certain ways I try to be peripherally involved. I don't sit on the council intentionally. I think that it's just like parenting. If you try to grasp your child too strongly, you suffocate them, and they don't grow and they don't change. And I don't think that necessarily a 75-year-old woman who's been retired for 10 years knows what an incoming surgeon needs or what is best to do to help them. So I try to be supportive when asked, but I really try not to get involved and micromanage the organization or even be there to have an opinion on everything that they think and want to do about that. And I'm hopeful. You had asked me also a little bit ago about, the international thing. I think that I wanted always to make AWS an international organization. And I do think that my being president of the American College of Surgeons put me in a very good position to help achieve that. During my presidency, I went to several countries who didn't have women's groups, who have formed them, and even since then, I've been to countries to help them form groups, so that being more visible and having a previous position of that, that nature has allowed me to develop that. But even before that, we started with the International Society for Surgery. And I do believe that even those relatively small efforts have made a difference, and that there are more women in the world empowered than there were before we started those efforts. Certainly the Japanese women have come a long, long way. The women in Africa are now really getting under power. I think that there have been real benefits internationally, and we are growing a group of women internationally who know one another, who address, issues together, who can help one another. And so I think the world is too small to be isolated. The Board of Regents are really trying to look at a total program for the college so that the international engagement is part of the college's mission and it's done in an organized way, not the squeaky wheel gets the oil.
Yeah, it's exciting. I know that at the meeting last year we had people from different parts of Africa and Japan, as you mentioned. I know you went to the Women in Surgery Africa, I think the launching event.
Yes, I did.
So there's definitely exciting things in the work, and as people will continue to spread the word and get involved, I think.
Right, and so I think that, it'll be helpful. And Africa is one of the countries that most needs women because they need surgical workforce, and the most logical source is women because they've, I think, tapped out on the men who are really interested. So, getting women to be involved will make a huge difference.
What are some of the things you've been very proud of in the recent development of AWS? And is there anything you foresee as a challenge or something that you feel needs additional attention in order to further improve AWS?
Well, I'm really proud of the continued quality of the leadership within AWS. The women who have risen to the presidency and have taken active roles in AWS are really pretty spectacularly talented women. And they've done well not only in AWS, but they've done well in their own institutions and even nationally. If you look at the American College of Surgeons Board of Regents, there are several past presidents of AWS who are regents. I mean, Beth Sutton, Lee Neumeyer, Linda Phillips, and Margaret Dunn. And that's half of the women on the Board of Regents who are past presidents of AWS. Mm-hmm. And others have been involved or have been involved in their own women's organizations. So I'm very proud of that. I'm very proud of the quality and the continued enthusiasm. I think that the continuing development of chapters has been good. I think the quality of the program at the national meeting remains excellent. I think that if there's anything that I worry about, I worry that a lot of younger women think that the battle has been won and that there is equality. And I got news for them, there isn't.
Can you speak a little more to that? What challenges do you think?
There still is not equality in pay. There's not equality in the granting of research money. There's not equality in the number of women in leadership positions. It still is harder for women to climb that ladder, I believe, than men. There still are, most institutions do not have family leave policy or it's not implemented. It's far more likely that a man will be given time off because of injury, et cetera, than a woman will for pregnancy. And it's still almost like you can't speak about childbearing and pregnancy without it, causing you to be viewed as a weak sister or something. So there's still a lot of issues, and most of them happen after residency. At residency, your pay is by the level of your residency, et cetera, so that you get things there. I think that women in the residency are more likely to be given research positions in labs on an equal basis to men. But boy, once you get out, that doesn't happen. Mm-hmm. So it still is a battle to get equality.
Right, I completely agree, and I know AWS has focused on, as many other women in high power level positions have focused on negotiation skills as well as any other awareness of this scenario and trying to improve transparency.
Yes. But it's not transparent, and I don't know of any institution where it's really transparent. What you get paid seems to always be one of the most highly guarded secrets, and there are always ways to get around it. There are always these little side deals that are made that you may think that your baseline salary is the same as the men that have come at the same time as you, but you get this little perk here, that little perk there. It just is undone at a certain point. It'll be interesting to me to see if the women as leaders are more fair than the men have been.
Yeah, and that remains a challenge as well. Whether or not there's a battle to get to where we are, and then as the AWS thing discusses, the empowerment aspect is something we need to continue to focus on too. Mm-hmm. So what do you think for those of the younger generation of medical students and residents? What can they do at this time? Even if you find out a lot of these things after residency, is there anything and advice you can give to them?
I think that you need to prepare yourself as well as you can for your future career. And I think you should be guided by your own internal desires, what you want to be and where you want to end up. and hopefully there will not be impediments to you getting there. But don't let the impediment be your lack of preparedness. When I did my residency, there was an option to do research. I didn't take that option because in many ways I didn't see an academic career in my future. And even when I finished and I did research, I hated it. So I ended up quitting and doing surgical education. Was told that I'd ended my academic career because surgical education wasn't a viable academic activity. So I think that to a certain extent, you need to kind of follow your own path and just be prepared. And if you want to be viewed as an expert, you have to make yourself an expert. So you do need to get the best training that you can and be most prepared for whatever job it is that you want. I think hopefully the women ahead of you will continue to make it better for you. And I believe that's true. I think that they will. And hopefully by the time the people who are in medical school now get to the associate professor level, they won't want to drop out because it will be as good a career for them as it is for men. And I'm hoping that with more women in positions of leadership, that it will be a better environment for everybody, for men and for women. So I'm optimistic about that, and I'm hopeful.
So we've kind of glossed on this topic, some about mentorship and having looking up others and empowerment and that. Mm-hmm. Mentorship is a very common topic, especially for people in medical school, residency, and even attending. And so there's been discussion about having one primary mentor versus many mentors. So what do you have any words of wisdom about seeking out a good mentor-mentee relationship?
I think the whole mentorship thing has made the relationships that people always have developed with one another too formal. Mm-hmm. I think that you actually are drawn to different people for different reasons, and it's the people that you're drawn to who will help you. They're usually people you admire, that you share common interests with, etc. And I don't think you can assign people to someone either way. I think that doesn't work. And I think it's been one of the major reasons for failure. And I don't think that you can have a million people that you are a mentor to. I think that you need to have a certain group of people that you have the time and the interest to spend quite a bit of time with. And that makes the relationship. And I do think you have different people for different reasons. I mean, I would be a terrible mentor to someone about their family and raising children. I've not done that. I have no desire to do it. And quite honestly, I don't want to hear about it all the time. So that would not be something that I could do for you. Whereas I can teach you how to develop a practice and how to look at developing your career and what organizations you maybe should join, helping you get into them, encouraging you to write, looking at ways that you can get publications, etc. So that I could be helpful. I'm not a good financial advisor. There are different things that you're good at and that you like doing. I mean, it's painful for me to have to deal with my money. I hate to have to go and talk to my financial advisor about what I should do and what I shouldn't do and how much I can spend and what I shouldn't spend and all that. I just hate it. Mm-hmm. So I would never be good to help somebody with that.
No, I think that's a refreshing perspective. I think you're right, but not forgetting about the organic nature of some of these relationships and the time investment necessary. And I think it's pretty often that we view mentorship as a product we can obtain some benefit from in order to further our career, but at the same time that cheapens the natural progression of the relationship. And you point out, well, we shouldn't lose sight of the natural gravitation toward people, and that we can get guidance from many different people for different things as we try to move forward in our career. Now, will you be at the AWS meeting in DC in October?
Yeah, I'm on the program, so I'll be there. My goal is to go to 50 consecutive college meetings, and I'm up to 48, I think.
Wow, that's an impressive streak, and I'm sure it'll be a great meeting. Well, I just want to thank you again, Dr. Numann, for taking the time to do this interview. I know that I personally really enjoyed speaking with you, and I'm sure our listeners, from medical students to attendings to people outside of medicine, will enjoy this as well. So thank you very much, and we look forward to seeing where your career continues to take you.
Okay, terrific. Thanks.
Bye.